One leg lumbar extension investigates the possibility of vertebral stress fracture or forward slippage causing low back pain. Vertebral slippage, called spondylolisthesis, occurs as a result of stress fractures that develop in the pars interarticularis, located between the superior and inferior articular facets of the vertebra. If stress fractures worsen, the vertebra may slip forward. This is most likely to occur at the L5 vertebra as it articulates with the sacrum. The client will simply stand on one leg and lean back into extension as far as possible. If there is pain with this motion, there is a likelihood of vertebral stress fracture or possibly forward slippage of the lumbar vertebra. If the pain is only on one side, it's most likely it will be felt when they're standing on that affected side. This motion could also produce pain with several other conditions, such as lumbar facet syndrome, so consider a number of possibilities with this test. The straight leg raise test evaluates for the possibility of sciatic nerve root compression in the lower lumbar region, or problems that may exist with adverse neural tension. Nerve root dysfunction usually results from an obstruction in the lumbar region. The primary region where they occur is where the nerve roots exit the intervertebral foramen. Obstructions that cause nerve root compression include herniated discs, bone spurs, spinal tumors, and spinal stenosis, which is a narrowing of the intervertebral foramen. The purpose of this test is to evaluate for nerve involvement. Through each of the steps of the test, the nerve roots are increasingly pulled taut in order to evaluate for neurological symptoms in the sciatic nerve distribution. If symptoms increase, there is a likelihood of obstruction pressing on the sciatic nerve or another type of neural tension pathology. With your client in a supine position, bring the leg and flex the hip till the point at which pain is reproduced down the lower extremity. The sciatic nerve becomes taut at about 70 degrees of hip flexion, so it's usually somewhere around this point where pain or discomfort will be felt. From this point, slightly back off from that position and see if the pain is reproduced to make sure it's not pain that's felt in the hamstring regions from stretching the hamstring muscles. At this point, have the client dorsiflex the foot, and the last step is have them to flex the head and neck region. We're looking to see if there is pain reproduced at any one of those steps indicating neural pathology. If pain is felt at any of those steps, it's not necessary to go on to the remainder of the other steps of the test. The Bowstring Test also evaluates for structures pressing on sciatic nerve roots. The test is similar to the straight leg raise test, but is not considered quite as accurate. Pressure is applied in the popliteal region, and that pulls on the sciatic nerve without further stretching the hamstring muscles, which distinguishes pain from hamstring tightness. Again, bring the client's leg into full flexion to the point at which it reproduces the neurological discomfort down the lower leg. Slightly flex the knee, only about 20 degrees or so of the knee flexion, and take the two thumbs and press back into the popliteal space so that you press on the sciatic nerve. If this reproduces neurological sensations down the client's lower leg, it's putting additional pressure on the sciatic nerve that may be indicative of sciatic nerve root pathology or neural tension problems in the sciatic nerve. The slump test was presented in the next section to investigate neurological restrictions in the cervical region. This test is also valuable for evaluating similar neurological restrictions in the lumbar region. You'll remember there are several different steps for performing the slump test. The client begins with the hands behind the back. The first is the upper thoracic slump, then the head and neck. Next comes extension of the knee, and finally dorsiflexion of the foot. In this instance, if neurological sensations are created down the lower extremity, this is indicative of lower lumbar nerve root compression on the sciatic nerve roots. This could also be a problem with neural tension in the sciatic nerve distribution down the lower extremity. The previous two tests, the straight leg raise and the slump test, designate problems in the lower lumbar nerve roots that feed the sciatic nerve. The prone knee bend test is used to evaluate compression or excess tension in the femoral nerve. Its nerve roots are in the upper lumbar region. For this procedure, simply bring your client's knee into flexion as if you're stretching the quadricep muscles. Go to the far end of that range of motion and see if this reproduces any neurological sensations on the front side of the thigh. If there are neurological sensations created on the anterior thigh region, this could be indicative of excess tension on the upper lumbar nerve root region, indicating some form of compression in those lumbar nerve roots. Make sure to distinguish the sensations that the client feels as a neurological sensation on the anterior thigh and not simply that of quadricep stretching. Myofascial techniques can be subtle, yet make a significant impact on tension reduction in the muscles that lie directly below the fascia. Fascia has a neurological relaxation response from these techniques. As the fascia relaxes, so do the muscles below. Certain myofascial techniques are good for situations in which the client requires a more gentle treatment approach. These techniques can be performed in many areas of the lumbar or thoracic regions. For these subtle myofascial techniques, simply apply a very gentle pressure with your hands. It's almost just the weight of the hands placed on the client's low back or thoracic region. Pull slack out of the tissue and feel the pull of that fascia in between your hands. Hold it for several moments and until you feel a tissue release in between the hands. It may take several moments before you'll feel that tissue release. Then do it in different planes so that you're pulling and stretching all the fascia along different planes throughout the lumbar and thoracic regions. Some of the myofascial techniques are not quite as subtle in their approach, but incorporate more significant pressure. These can be done with or without lotion, but frequently are done without so that you can pull more tensile force on the fascial tissues. For example, using the fingertips with moderate pressure and pulling and stretching that subcutaneous fascia with your fingertips. Or techniques such as skin rolling, where you pick up the skin and pull the subcutaneous fascia and roll it underneath your fingers. Some of these sensations can feel moderately intense for the client, so check in with the client about the pressure level periodically. These fascial techniques are particularly effective prior to working on some of the deeper muscles down below. Muscles of the upper back often develop chronic tension and myofascial trigger points due to postural strain. The muscles of the thoracic region include the erector spinae, serratus posterior superior, rhomboids, latissimus dorsi, as well as the mid and lower trapezius. Over-lengthened muscles resulting from postural distortions, such as upper thoracic kyphosis, can house myofascial trigger points that require deep specific work. Compression with active engagement is best performed after techniques such as effleurage or sweeping cross fiber that would relax the superficial musculature. For this technique, simply find tender points in the rhomboids or mid-trapezius and then have the client engage in an active concentric action of retracting the shoulder, pulling it back together so as if the shoulder blades were being squeezed together in the back while you maintain pressure on that point. Again, find a tender point. The client retracts the scapula while you maintain pressure on the point. Hold briefly with the muscle fully shortened. The client slowly returns to the neutral position. Repeat this process several times, working on areas needing attention. You can step up the intensity ladder and address the rhomboids and mid-trapezius with an active engagement lengthening technique. Apply the stripping technique during eccentric lengthening makes the stripping technique even more effective for encouraging tissue elongation. Just as before, find tender points or areas that you want to focus on in the rhomboids and mid-trapezius muscles. Begin with a small contact surface near the vertebral attachment of these muscles with either a thumb or fingertip or pressure tool perhaps. Applying pressure in this region will now have the client retract the shoulders as if bringing the scapula together in the back, and now slowly swing the arm around the front so that the scapula moves in upward rotation and protraction. You'll repeat this stripping technique several times once again, and slowly swing it around the front. Now each time the client swings it around the front, make sure you don't go over the vertebral border, but you stay on this side of it so that you're not pushing directly over the top of that vertebral border. Once again, bring that arm up into retraction and slowly swing around the front. And you'll repeat that several times until the entire area has been adequately covered. After lengthening and reducing tension in the upper thoracic muscles with stripping techniques, stretching and joint movement further reduce muscular tension for chronic muscular problems. This scapular mobilization technique stretches the scapular stabilizers in the upper back. Place one hand underneath the anterior surface of the client's shoulder and the other hand positioned so the inferior angle of the scapula is cupped between the thumb and the index finger. Gently lift the scapula up off the thoracic rib cage, and now you can mobilize it in both upward and downward rotation, stretching the scapular stabilizers. You can hold each position and simply hold it in this pulled up position to stretch those muscles fully. For ideal optimal muscle function, a muscle must be able to lengthen and broaden fully. Deep broadening on the spinal extensor muscles encourages the muscle fiber spreading and reduces fibrous adhesions that can develop from chronic tension. For this deep broadening technique, turn the hand so that the thumbs can apply pressure and give a deep broadening stroke to the lumbar paraspinal muscles. You can work from their vertebral attachments laterally and move up through the whole length of the spinal muscles as you do this deep broadening technique. Since you're applying a moderate amount of pressure while you perform the broadening technique, you don't want to go too fast. Going too fast across those muscles will give them the sense of strumming or plucking and can be quite uncomfortable for the client. A slow, deep broadening stroke is going to feel much more comfortable and be much more effective in helping to encourage fiber spreading of those paraspinal muscles. Deep stripping techniques are an excellent way to reduce tension in the paraspinal extensor muscles. These muscles provide the primary vertical support for the torso. They extend through the length of the lumbar and thoracic regions and include the multifidus, which is closest to the spine, and moving laterally are the spinalis, longissimus, and iliocostalis portions of the erector spinae group. Perform initial relaxation massage prior to doing the deep stripping techniques. The deep stripping techniques can be done with either a broad contact surface, such as the backside of the fist, or the heel of the hand, to begin with, and apply this stripping technique throughout the entire length of the lumbar paraspinal muscles. The broad contact surface with depth of pressure allows some initial relaxation in these muscles before we come in to do our more specific stripping applications. To perform the deep specific stripping, begin with the thumbs or fingertips or knuckle or a pressure tool or elbow on the paraspinal muscles Once again, you may want to begin this at the very top edge of where those muscles begin and do a longitudinal stripping technique throughout the entire length of those paraspinal muscles all the way through the thoracic region and down into the lumbar region as well. It's a good idea when you're doing any of these deep stripping techniques to check in with your client about the pressure level. Does that pressure level feel okay in there, Barbara?
Yes.
Okay. Too much pressure and those muscles may start splinting or bracing up against you. With this deep stripping technique, carry the stroke all the way down over the top of the sacrum because the attachments of those lumbodorsal fascia tissues are all directly over the sacrum. Any areas that are tight and restricted, you can come back and repeat several strokes once again over those same areas with your deep longitudinal specific stripping applications on the lumbar extensors. And continue this in parallel strips, running all the way down along these paraspinal muscles until they've all been thoroughly treated throughout the entire thoracic and lumbar regions. The deep stripping in the lamina groove I demonstrated on the neck is also beneficial for the lumbar and thoracic regions. The spinal muscles within the lamina groove include the deep and short rotatories as well as the multifidus. In this technique, you'll be pushing against the vertebra, so be cautious with your pressure. The deep stripping technique in the lamina groove is performed by placing the thumbs or other small contact surface right in the area just adjacent to the spinous processes. One thumb is placing pressure in the direction of those spinous processes. The other thumb is at about a right angle to that and pressing in the direction that the stroke is traveling. Begin up at about the C7 level, press into that lamina groove, and apply the slow, steady pressure and gradual stripping movement down the length of the thoracic and then lumbar spine. If you find areas along here that need a little additional attention, if there's a little greater restriction or tightness in some areas, just pause, do a little bit of back and forth longitudinal friction on there, and then continue on down through the lumbar region, and the stroke will continue all the way to the top edge of the sacrum where the distal fibers of that lumbodorsal fascia blend over the top of the sacrum. This can be repeated several times to make sure you've gotten good, efficient pressure throughout the length of those muscles in the lamina groove. This technique can also be applied not only from a superior to inferior direction, but could also be done from an inferior to superior direction as well, if that hand position is preferable. The Quadratus lumborum is frequently involved in a variety of back pain complaints, from postural disorders to acute spasms. It is deep to the other back muscles and is a critical postural muscle, having effects on the lumbar, thoracic, and pelvic regions. Its main function is to laterally flex the torso. Treat the superficial muscles prior to the deep stripping, particularly on these deep muscles. Our deep stripping techniques on the quadratus will focus on the fibers running predominantly from the iliac crest over to the transverse processes. Begin with a small contact surface such as the thumb or fingertips just at the top edge of the iliac crest, and perform a slow, deep stripping technique right to the edge of those transverse processes. It's important to communicate with your client about the pressure level here so you can determine that you're not applying too much pressure in this area. Barbara, is that pressure level okay in there?
Perfect.
Okay. There are also fibers running from the iliac crest up to the 12th rib, and so you can do that stripping technique up toward the 12th rib on those fibers as well. The quadratus lumborum muscle is often shorter than it appears, so the area that you're working may be relatively small. As you're performing some of these stripping techniques towards the transverse processes, avoid putting direct pressure on the tip edge of the transverse process and just come right up to the edge of it with your stripping technique so that that doesn't put uncomfortable pressure on the transverse processes. The pin and stretch technique is an effective way to access and treat the quadratus lumborum without attempting to put too much excessive pressure through the depth of the other back muscles. This technique also uses eccentric activity in the quadratus lumborum along with the pin and stretch to reduce hypertonicity. For the pin and stretch technique for the quadratus lumborum, have the client abduct the leg fully and hold that position to engage the quadratus as it attempts to stabilize the pelvis. Place your thumbs or fingertips directly on the quadratus and have them slowly drop that leg off the side of the table so that you're pinning the muscle in the shortened position first and then it's eccentrically engaged into its lengthened position. This can be done with another variation where instead of a static compression technique, you perform a stripping motion. Once again, have the client bring the leg into an abducted position and from that position slowly drop that down and do a stripping motion on the quadratus during the elongation so that the eccentric activity and the stripping motion together both combine to help good elongation of the quadratus lumborum fibers. Let's take a closer look. With the muscle in a shortened position, apply pressure to the quadratus while the client slowly lowers the leg. After treating the quadratus lumborum, stretching is important to encourage full elongation of those tissues. The active assisted stretching technique is also performed in the same side-lying position as the previous technique. This approach is a very effective way to stretch the quadratus, which can be difficult to stretch during treatment in certain positions. For the active assisted stretch on the quadratus lumborum, have your client first grab a hold of the upper end of the table to stabilize the upper torso. Then engage the quadratus in a contraction by lifting the leg up here. Attempting to abduct the leg engages the quadratus as it attempts to stabilize the pelvis. From this position, once you hold that contraction for 3 to 5 seconds, have the client just relax it and now let it go down so the leg drops off the back side of the table. This hand is positioned so it cups around the upper margin of the iliac crest and the other hand presses down on the knee or the distal thigh. Lean into that stretch so that the hand that's on the iliac crest gives a nice pull and inferiorly directed force on the pelvis, helping to stretch the quadratus. This hand that's on the distal thigh is pushing down towards the ground just to aid that stretch slightly in this position. This stretch can be repeated several times for maximum effectiveness. Active assisted stretching for the iliopsoas is an effective way to encourage lengthening in the muscle without putting deep pressure in the abdomen. The iliopsoas lies deep in the abdomen and has two major components, the psoas major and the iliacus. It is an important muscle to treat in many lumbopelvic complaints, especially postural disorders. However, abdominal approaches to the iliopsoas should be avoided as the abdominal organs can be pinned against the muscle. These tissues are not designed to have continual pressure applied to them. Pressing on the psoas major may inadvertently compress the external iliac artery and rupture an aortic aneurysm. Your client may not know they have an aneurysm, so this is a serious precaution. For the active assisted stretch with the iliopsoas, you'll use a position similar to that used in the Thomas test. Have the client attempt to just barely sit on the edge of the table. Hold the table down with your knees so that it doesn't fold in the middle. Have them reach and grab a hold of one leg and slowly help them into a position rolled back onto the table. Now for the iliopsoas, simply get into position and the client will attempt to lift the thigh. So Barb, go ahead and pull your thigh up against my hand. Hold it there. That's good. Hold that for about 3 to 5 seconds and now relax. As the client relaxes, slowly push that down into a further stretch. We can repeat that technique several times. Again, hold this here and slowly relax. Each time getting a little bit more stretch. It's a good idea not to engage the contraction from the fully lengthened position so it doesn't overstress the low back muscles. As your client is coming out of this position, go ahead and help them roll back up off the table so that they don't stress their low back muscles trying to get out of this position.